Good afternoon, everybody. It's clear to me that Shark Tank has nothing on the Lion's Den. Welcome, everybody. You're in for quite a treat. We have an incredible group of lions here who are going to hear presentations from companies and make recommendations, etc. My name is Dave Soren. I am the chair of the Venture Capital and Emerging Growth Company practice at McCarter & English. We are delighted to be here and to be sponsors. And anyone who wins today will be given a gift, if you will, from McCarter & English of free legal services in connection with that first investment. So we wish everybody luck and have a great time.
The lion, fierce, steadfast, being of great strength and courage. Enter the lion's den. Impact's Lion's Den. Jonathan Brassington is the CEO and co-founder of Liquid Hub. Brassington is an avid technology strategist and speaker, as well as an early-stage investor in a variety of technology-driven businesses.
Success is all about the people. It's about hiring the right people at the right time.
Walter Buck Buckley, revered simply as Buck. Buck is the co-founder, CEO, and chairman of the board of Actua, a multi-vertical cloud company.
What I really want to see is a clear and compelling value proposition for your customer. One that you can articulate and measure for both your customer and for your business.
Dr. Robert Corrado is a founder and managing partner of Devon Hill Capital Partners, a diversified healthcare investment firm focusing on content and technology-enabled healthcare service companies.
Have focus, have passion, know your business inside and out, understand your data. Remember, entrepreneurism is 50% idea and 90% team.
Michael Hagan is co-founder and managing partner of Hawk Capital Partners. Hagan has also served as the president of LifeShield Security.
You better be passionate. You better know your market. You better understand who your customer is.
Michael Wells is a managing director at Princeton Biopharma Capital Partners, LLC, a private equity firm focused on providing growth capital and operating expertise to commercial stage healthcare companies.
It should be very clear within 30 seconds what problem you're trying to solve.
Our lions are on the hunt to find the next big idea. Are you ready to enter the Lion's Den? Impact's Lion's Den. Please welcome our lions. Jonathan Brassington, CEO and partner, Liquid Hub. Walter Buck Buckley, co-founder, CEO, and chairman, Actua. Dr. Robert Corrado, founder and managing partner, Devon Hill Capital Partners. Michael Hagan, managing director, Hawk Capital Partners. Michael Wells, managing director, Princeton Biopharma Capital Partners. Ladies and gentlemen, please welcome our moderator, Mark Letterman, general partner, New Spring Capital.
Good afternoon, everyone. We're really excited to be having this session here to kind of close out what I think has been just a fabulous conference. You know, entrepreneurism, of course, is about a lot of risks and taking risks, and quite frankly, this panel is a bit of a risk. We've never done this before, but we've got 5 real lions who are willing and ready to write a check to support some of these aspiring entrepreneurs here that presented today. We had 45 companies present over today's sessions, and 3 have been selected to enter the Lion's Den. A couple of ground rules you'll see, I believe, on the website, yorn.com. If you could bring up that slide for everyone. If you open up your browser in your smartphone, you'll be able to log on, and they'll give you the URL in a moment here on the screen, hopefully. And you'll be able to pose questions to me as the moderator that you'd like me to maybe ask the company. And more importantly, after each entrepreneur finishes their presentation, you'll be able to vote as to whether or not you would have been willing to write a check to support that particular entrepreneur based on their idea. And at the end of each session, we'll put up that poll and see how the entrepreneurs did in convincing you to part with your hard-earned cash. Each entrepreneur will be given 5 minutes to present, and then there'll be 10 minutes of Q&A/negotiation with our lions. Each entrepreneur will make an ask, just like you've seen on the TV show, and that ask will be in terms of certain dollar amounts as well as a percentage of their company. And our lions here will have the ability to negotiate and see if a transaction can be had. Each lion has the ability to either outbid each other, or if they would like, syndicate together to bring a larger amount of capital to one of the particular companies. The lawyers in the room have asked me to make a couple of comments. First, it's called the Lion's Den because some of the lawyers were afraid that if we called it Shark Tank, we might be sued for trade infringement. Those lawyers will remain nameless. But more importantly, this is not a broad solicitation to the audience. They're just soliciting these accredited investors here up on stage. And with that, we'll now turn it over to our first entrepreneur. And the first company that was selected to present today is Fitly.
Thank you very much, guys. So please cue the presentation. My name is Anthony Ortiz, and I'm the creator of SmartPlate, the best way to eat healthy. A few years ago, I had to watch my dad suffer through triple bypass surgery, and that was one of the toughest moments for me and my family. And that was when I started realizing and doing a little more research about the space and this, poor nutrition in general. And what we found out is that poor nutrition is now a global pandemic, with obesity, diabetes, heart disease, and hypertension all running amok. And every day, over 100 million Americans turn to manual calorie counting applications, which are tedious, frustrating, but worst of all, they're inaccurate. SmartPlate is the world's first intelligent plate that instantly analyzes your entire meal with up to 99% accuracy. It uses image recognition technology and load sensors to identify and weigh everything sitting on its surface, from single foods to prepared meals like vegetable fried rice, pizza, and even a garden salad. Please cue the video. So all you have to do is place your food on the plate the way you normally do. You're going to tap on the LCD screen in the center. SmartPlate will take a picture, send it to our cloud for analysis, and within seconds, bam, you get all your nutrition information in a snap. Now I know what you're thinking. That's awesome, but will it cook the food for me? Absolutely not, but it is dishwasher and microwave safe. So are you ready to be a customer? Because if you're a health-conscious consumer, need to lose a few extra pounds, or you've got a dietary condition related to poor nutrition, then SmartPlate is right for you. In fact, our serviceable obtainable market is 14 million Americans, and this represents a total market cap of $2.2 billion, an opportunity that you don't want to miss here today. We're starting off with a focus on athletes, bodybuilders, and CrossFitters, and proving that with that foothold demographic, which is about 700,000 Americans. And Philadelphia is a healthcare hub, but ironically, it's also #1 for obesity, diabetes, and heart disease. So our mission is to change that. And we, with our partners and anchor investors like CHOP, Penn Medicine, Independence Blue Cross, University City Science Center, the American Heart Association, our goal is to prove the efficacy of SmartPlate so that we can eventually have it reimbursed. And this is a pilot study that we've spent a lot of time designing, and we're going to launch this in Q2 of 2016, along with CHOP leading that effort. Where are we today? To date, we've sold over 1,500 units in 17 countries. We've generated over $150,000 in pre-order sales. We have $10,000 to $15,000 in recurring revenue monthly. And we have a contract with Winnet Distribution, the largest distributor of connected devices in North America. We also have a manufacturing service agreement with Flextronics, arguably the #1 manufacturer in the world. And we also brought on Jackie Joyner-Kersee as co-founder and head of wellness. We met with QVC. They're very interested in what we're doing. And most recently, just Sunday, we were in the top 25 of Richard Branson's Extreme Tech Challenge. That is not photoshopped, I assure you. And we're excited because if we get into the top 10, we're going to Necker Island and we're going to be featured at CES, an amazing opportunity for us to mingle with the right folks there. So how do we generate revenues? We sell hardware and we sell monthly app subscription services. On the hardware side, our markup is above 200%. On the subscription side, we're seeing margins of above 50%. So there's plenty of room for the Lions to generate a healthy return. So our ask today is $250,000 for 5% stake in our business. 4% of that will be used towards the round, and we would love to leverage your expertise and advice. 1% will be advisory shares, given the relevant experience that some of you have on the panel. Our team knows how to do this. Prior to this, I started a company called Eco Express, which I grew to a 30-person team, generated $1 million under 12 months, and sold the company 18 months later. Jackie Joyner-Kersee is a known winner, a 6-time winner, and has also raised over $12 million for her charitable foundation. And Dr. Domingo Mary has developed algorithms that can identify food defects with up to 98% accuracy. He's written over 60 peer-reviewed publications, featured in conferences like IEEE, and also holds 2 patents on the subject matter, one in which we hold together. Thank you so much. If you have any questions, I'd love to answer them.
Great. Now, remember, audience, you can go to yourn.com/impact, and you can vote as to whether or not you think this is something you'd fund. And with that, let's turn it over to the Sharks, or the Lions, I apologize, the Lions, and see what they have to say.
Anthony, can you tell us more about the patents you have and what they're protecting?
Yeah, sure. So we have 3 non-provisional patents. One is for a multi-unit scale with embedded cameras. There's no technology like that. And then the second patent is for a plate that uses a predefined object and holds a top view from a cell phone. So without the embedded cameras, but using segmentation and a predefined object. And then we have a design patent for the design that you see there today.
So Anthony, think about it in the context of this audience here. We're all active people. We're eating out 7, 8 times a week. How exactly did you envision the adoption of the smart plate? Because obviously we all get that there's a market to understand our calorie intake and our health, overall nutritional value, and how it relates to our health. How do I go about taking the smart plate to Capitol Grill?
Yeah, that's a great question. So, you know, when we looked at the user experience, we really put ourselves and empathized with what that looks like when someone wakes up. We don't always eat from a plate that looks like this, right? We eat from a bowl sometimes. We eat from a smaller plate. We eat at a restaurant. So this is just the beginning. The plate will be, when you looked at the image there, it is a removable base, so will allow for future form factors, such as a bowl, such as a smaller form factor of a dessert plate. The app itself uses the same image recognition as the plate, so when you're at a restaurant, right now we have over 100,000 restaurant meals. We use geolocation. We know you're pulling up at Houston's or Arby's, and the menu instantly pops up, so we capture that data from the restaurant that you're eating out. So we're capturing the user ultimately at every stage of consumption. We also capture them at the point of preparation. So Smart Plate also comes with a prep lid. So let's say you're cooking for a family of 4 or 6. You're going to put the prep lid on top. It'll engage all 3 scales. You can weigh up to 3 pounds of food at once.
That's a lot of food. So Anthony, it's a device that you've got to have. You've got to carry it around. It's kind of there. And we know, smartphones are ubiquitous now. Google has kind of put an offering out there as well where you can kind of take a picture and you can get close. I guess my question is, how accurate do you need to be for people to use this? And what competitive advantage does it give you to have to lug this plate around compared to me pulling my phone out and just taking a picture and just being good enough?
I'm so glad you asked that, and here's why. Because a 50 calorie difference is equivalent to 5 pounds of weight loss per year, 110 pounds. So when you're using these apps that don't have a scale, and they're using image recognition and trying to deduce volume and density from just an image, it's so difficult to do that Google will reach 70% accuracy at best. And that difference will be reflective in your results, which will be very, very little results. And
But I'm going to push back, though, because I can't see myself using this plate often. I can see myself maybe starting and being excited about it, and then over time being, oh, friggin' plate. It's in the microwave, forget it. Yeah. If I can just take a picture of something and be 70% accurate, that's better than never doing it at all. And as a physician, if I can get my patients to follow half of the advice I ask them, we'd be in a good place. So 70%, frankly, might be good enough.
I think if it was good enough, though, you wouldn't have anybody using Fitbits and Jawbones to measure exercise. I really think that's who your customer is going to be.
That's exactly right.
The people that love to measure stuff.
So I don't think it's about accuracy. I think it's about measuring it.
Yeah, there's people who love to measure stuff.
But I think it's more about measuring it, not about accurately measuring it. It's more about just being able to measure it when prior you had absolutely zero before.
Their money counts the same as anybody else's.
You know, people said the same thing about
accurate.
People said the
but
same.
they're providing me something, though. They're giving me feedback.
These guys argue. Anthony, talk to me about the software as a service kind of component of this, because you know the weight loss category has a lot of free apps out there, and very few have been able to monetize that user base. Some have massive distribution, but very few consumers have been willing to put a credit card out there.
Yep.
So you say, you know, you have a product in development, it's not out there, but you got 10 to 15K in recurring monthly revenue. What are the customers paying for? What kind of features and services are they paying for in the app that they're not getting for free as part of buying the plate?
So right now we're just selling the hardware and the free app. Okay, so the way we're looking at this is as a freemium model. So when you buy the plate, you get to use the app for 30 days, and then it starts from day one. So most people are going to want to track for over 30 days, and if you want to track longer and above that 30-day mark, you're going to have to pay $4.99 a month. You want personalized nutrition coaching, access to personalized meal plans and recipes, $9.99 a month. And so that's how we're going to capture that audience. So it's a slow nudges into a premium service.
So you're telling me if you buy the plate after 30 days, if you don't eat your meals on the plate, you're not going to be able to measure your calorie consumption?
No, so it doesn't turn off. You can still do it. It just resets to day one. So you only track for 30 days, then it starts to your day one again. So most people want to see what happens after 30 days, a progression of over 90 days, 6 months, maybe even a year. So that's the way that we kind of get them to subscribe. But I also want to touch really quickly on the subject of user engagement and the app itself, right? So when Fitbit first came out, there was already an app called Runkeeper, right? And Runkeeper used GPS, and everyone said, why do you need a Fitbit if you have Runkeeper? You can just use GPS to track your steps. But the precision between Runkeeper and GPS and the accelerometer within the Fitbits was so drastically different that you could improve the performance and the results in the workout. So that's where I would push back a little bit there.
See, the only pushback I give you on that is I can wear that on my wrist. I'd look kind of silly with that plate on my wrist. That's the only thing.
You can't wear the
Anthony,
plate.
can we take a look at the plate?
Oh, absolutely, sure. So some of them have some food on it. So here's the flagship color.
Rob might like the feedback.
So the question is, what's the product development risk, you know, from a hardware standpoint first?
So manufacturing is really risky, right? And there's this valley of death, going from prototype to actual manufacturability. So we don't have that expertise on our team. But what we did do is we have a manufacturing service agreement with Flextronics. They don't work with startups, but they're making a bet on us because they see the opportunity for the smart plate. So Flextronics has brought millions of 21 million to be exact of the Fitbits that you see today. They're also the manufacturers of Breathometer, who's doing really well. And so we're confident that with Flextronics, we're going to bring this product to market successfully.
So that's really not quite answering the question. What's the risk?
The risk is that you don't get it right? So from an engineering and mechanical perspective, if this doesn't come together in a way that can be mass produced, if the plastic injection moldings don't come together precisely to produce those parts that will keep those partitions separately, those are the kinds of risks. So, but working with the best on the market, we reduce that risk significantly. We're pretty confident we will.
Anthony, do you have to take this apart to microwave it, or can
yeah,
you put this whole
so
thing?
it has a little gauge, and what you'll eventually be able to do is just tap on the little gauge, and it'll disengage from the base, and you'll just stick the plate in the microwave or in your dishwasher, and then the base can be used for other form factors, as I mentioned earlier.
So Anthony, how about inverting the model where for the premium customers or people who want to be those precision-based, detail-oriented people, they can get the plate, right? But how about tackling, you've got partnerships and integration with several different devices, You build technology where you're using the app. The app can give you a level of accuracy that might be reasonable for most of us here. So when we're traveling, we're on planes, we're in hotels, we're wherever, we can get the benefits we want. You're integrating with MyFitnessPal and all this other stuff. So I'd be thinking about how to invert that, and then maybe putting the plate at a level where you've got a certain type of customer that really wants that discipline and is open to it, and is probably open to the fact that even if I'm only using the plate 33% of the time, I'm getting that uplift in my efficacy, but I want to track my calorie intake all the time if I'm really interested in changing my lifestyle.
Yep.
So it's kind of a behavioral enhancer. But so my struggle at this point with it is I don't want to carry the plate around, so I'm out.
Okay.
So we've got one lion out. We've got 4 left.
By the way, I just want to touch on
how do you answer that question? I think it's a good question.
The app can be used. You don't have to carry the plate around. So the plate is used. Most people, by the way, families are eating 77% of the time at home. Only 4% of Americans are eating out more than 4 times a week. So most of us are still eating at home. 35% of us are bringing a doggy bag to work, right? So you have a portable pouch. You can bring it to work with you. It's a much easier thing to actually travel with and it comes with a portable lid. So you keep all of your food separated. We think this is going to replace the existing Tupperware, right? So we see a world where both of them are meshed, but we're going to tell the consumer that if you use the app more than you use the plate, you're only getting reasonable accuracy.
Talk to me about your customer acquisition costs. I mean, it looks like a lot of the customers you've acquired so far are pre-order through Kickstarter. You know, you got a $39 COGS and a MSRP of $140, but I guess a lot of what you expect to do is go through distributors and middlemen that you're going to charge $89 to $99. To me, the unit economics, while it's okay, it doesn't offer fat enough margins unless you really think that the razor blade model, the software is going to be really significant because it doesn't allow enough contribution profit to really invest heavily in marketing unless you get some kind of referral or word of mouth. And that's where I think that my standpoint, knowing the weight loss category, the model fails, so I'm out.
Okay, fair enough.
So our time is coming to an end here. We've got 2 lions out, 3 here. There's been an ask on the table.
Yep. What I would say is we have 2 products, right? So there's one with COGS that are $35. That's the embedded cameras. And then we have one without the cameras where you take the top view. That's $15 to manufacture each plate. We could literally at scale sell that plate for $49, and we will, and hit critical mass. So something to think about there in terms of the types of different products in the pipeline.
Yeah, I think it's a huge market opportunity. I think you can potentially position yourself as a leader in the space. I think Jonathan's point about flipping the model makes a lot of sense. So I'm in for $50,000 at a $2.5 million valuation, so for 2%. So it's lower than what you think, but I think there's risk involved, there's a model issue involved, there's a fair amount of work to be done.
I'll do the same. So you got 100,000.
At a $2.5 million valuation.
Yes.
So we raised 8 months ago, we raised a round at a $5.5 million cap. So I'd be doing my current investors a disjustice if I took a lower valuation. So I do have a fiduciary responsibility to my family, friends, and previous investors.
What's happened
so
before?
I would have to humbly decline on that offer.
See, I'd jump in with them at that valuation. At the valuation you're talking about, I have real serious concerns about the uptake. And frankly, I have real concerns about this being used for a week or 2 by people and then sitting on a shelf somewhere, never to be seen again. I think Jonathan is right on it. You want to do something that's easier. And I think there's potential legs here. And to Buck's point, this is a huge market. There's no doubt about it. But it's a high-risk market with this device. I join these guys at 150 at that valuation. If you can't do that, great.
So listen, you got an offer on the table. You got 150,000 on the table, $2.5 million valuation in common equity. Your convertible note probably may convert into a preferred or whatnot, so it may not be apples to apples. And you got the expertise that these 3 can bring to the table. You got to make a decision because we've got 2 more entrepreneurs waiting in the wings.
What I'd be willing to do is to go back to our valuation that we got 8 months ago. I couldn't possibly go below that $5.5 million cap, but I'm willing to match that if you guys are willing to take the ride with me. I can tell you that the exit strategy is between 3 and 5 years. The minute we bring this product to market, and we will next year, that valuation goes to $15 million. So you're immediately going to see a 2 to 3x return just by summer of 2016.
If everything goes well.
It will. No doubt about it.
I've never seen that.
No doubt about it.
I'm out.
Thank you, guys.
Okay.
Right.
I'm out.
Well, we're close, but no cigar, it looks like. Well, thank you
Thank
very much for
your time. I
presenting.
really appreciate it.
Good luck, man.
Good luck.
Thank you.
Good job.
Now, do we have the poll results from the audience can we bring that up? Did our audience vote to see whether or not they would have invested in this particular company?
Yes, all the
For the Yorn?
Mark, you need some dramatic music for the remember that for next year?
At this point, I'm just hoping for a slide. I'll take the dramatic music. All right. Guess not. All right, I'll tell you what. While we're working on that technology.
There we go. There it is.
Oh, there we go. So we had a predominance of no. So it looks like the audience, for the most part, agreed with our Lions. So so far, you're doing pretty well, guys, if you think our audience
Because
knows
we
what
always
they're talking
listen
about.
to what everyone else says. No offense. No offense. I'm just like,
Well, now we have our second entrepreneur coming up today, Mark from Photosonics Medical. Mark?
Very much.
See, it wasn't so painful. He walked away alive.
I got it. I'm in one piece. Thank you very much. It's really a pleasure and an honor to be here. I appreciate the judges who picked our company for this honor. We should go to my slides. And if I'm losing time already, I want to get to my slides.
We'll reset the clock.
Thanks. So I'm Mark Schaefer.
Give him an
I'm
extra
founder
15
and
seconds.
COO of Photosonics Medical. We're a medical device company. There we are. And we've got a new product, a revolutionary treatment for the problem of acne. I want to ask you a question. What if this could become this? In 3 weeks, for 5 minutes a day, treating at home without any drugs. That's the promise of our treatment. We've got a revolutionary treatment for moderate to severe acne. Let's put some numbers behind that. We're not talking the pimple before the prom kind of problem. We're talking significant acne that can cause severe scarring, permanent scarring. These are patients who have a real problem. Of that 20 million patients in the United States with that issue, we've selected the 5 million patients who are currently being treated by a physician, not those who are doing it at home with Proactive, those who are going to more severe treatments like Accutane. We're taking the moderate patients that are going to the physician right now. That represents 5 million patients, a $2.9 billion market opportunity there. We've run our numbers with our market model. We believe that our total addressable market is $1.5 billion with our product. What are the current treatment options? Well, it runs the gamut. Typically, patients start at one end and they work their way up the scale. Antibiotics, actually antibiotic resistance in acne is over 50%. Between 50 and 70% of the patients are resistant to the treatment. Next up is Accutane, or the retinoids. They work very well, but they are not antibacterial, and they have severe side effects, including things like birth defects, depression, suicide. There's benzoyl peroxide. Proactive is benzoyl peroxide with $200 million worth of marketing budget. It works very superficially. It doesn't get all the way down to where the acne really lies, and if you treat it with enough of a dosage to be effective, it's very irritating and drying to the skin, so a lot of patients go off of that. Finally, there's blue light treatments, both at home and in the office. They have not been shown to work effectively. There's a large unmet clinical need. Talk to your teenagers. They want something that works. What do we have? Cleanse, coincident light energy, and non-focused ultrasound. We're combining two energy technologies together in a new way that hasn't been done before. We use both energies at the same time, low-level ultrasound and blue light. Basically, the sound activates the bacteria, causes it to rev up its metabolism, and becomes susceptible to the blue light, which kills it. It's proprietary. We have 3 issued patents, 4 more on the way. And we've demonstrated that you need both energies at the same time. You can't do one and then the other. You need both at the same time. We've known from years and years of experience in this marketplace, if you can kill 90% of the bacteria on the skin, you will get clinical effectiveness. We've shown in our data that we can get over 99% killing in as little as 28 days. This is with less than 10 minutes a day of treatment. We can get over 90% bacteria reduction. No other device technology has shown this level of reduction. And because it's a device and not a cream, we can plug into that Internet of Things. Compliance is a big issue in this market. A tube of antibiotics can't tell mom that Johnny hasn't used it that day. But our device, if Johnny doesn't use it, mom can get a text message, the doctor can get a text message telling him what the compliance issue is. How do we make money on this? This is going to be a prescription device for at-home treatment. Basically, the script will be written. We will supply the device to the patient for $99 a month. There's a consumable, disposable part of this, the blade part, that the physician can supply for estimated $39 a month. Combined, $138. That actually puts it in the middle of the price range what people are spending right now out of pocket, including insurance deductibles, for the other treatments. We combine physician revenue with patient convenience. And this approach has been vetted in other diseases like psoriasis and hyperhidrosis. Our first target is the dermatologist, a very targeted market that we can control very well. It's a prescription device. Then we expand to the Walmarts, the CVSs, the retail clinics. We've already been in discussion with both of those companies. Then the med spas. Eventually, this is a consumer-facing product, OTC, although we won't be involved in that, but that's where we want to go. We'll be out of the game by then. We expect somebody else will pick it up by that point. Our major milestones, we've already raised $735,000. We just closed a $330,000 round of convertible debt. That allowed us to start the pilot trial. It'll be starting in another 2 months. What we're raising right now is our C2 round, which will, in parallel with that, allow us to get our first FDA clearance, get our 510K. This is the 510K product with a predicate. Once we have both the pilot data and the FDA clearance, that will be a big valuation jump when we go for our Series A, which will allow us to do the pivotal trial, do the product development and the commercialization, and we expect to launch the product in 2018. Who's the team? I've been doing this ultrasound stuff for over 30 years. I'm a serial entrepreneur, started my first company in graduate school at Drexel many, many long years ago. My partner is Tessa McNeely, one of the subject matter experts in dermatology out of Merck and the NIH. Adam Dakin is our executive chairman, a serial and medtech entrepreneur. Our advisory board are the 3 top acne experts in the country. So in summary, we've got a device approach to a very large drug-sized market. We've got efficacy data. We've got issued IP with a very simple 510K pathway. We're very capital efficient. We've done this before with very, very clear milestones, which I can detail. Focused on that market rollout plan from the derms all the way out to OTC. We're raising $500,000, and we'd be willing to take that on a $5 million valuation, and that's our offer today. Thank you.
Thank you, Marty. Now, for the audience, don't forget to vote. Make sure you pick the right company. You got to move to the next company as you're voting. And with that, let's turn it over to our Lions.
Mark, in that human data, was there a control group?
We had the opposite side of the cheek. Basically, that data involved...
So it's self-control.
It was self-control. Not that we have a lot of self-control, but yes, on each of our studies, we would have an untreated and a treated side as a comparison. And on that, we also had the pre-treatment as a bacterial standard, and then we worked down from there. Okay. We also did the studies treated light alone or ultrasound alone, showing the lack of an effect. So we know we need the synergy. There's also scads of in vitro work behind this, lots and lots of laboratory studies to kind of optimize the treatment and detail exactly what would work.
Gotcha. Can you talk to us about your patents?
Sure. We have 3 issued patents that cover, 2 of the patents cover the device approach to combining ultrasound and light in a single treatment head, and then we have a method patent, more general patent on the method of application of light and ultrasound to the same tissue volume at the same time. And then we have 2 continuation in parts to expand it further. Basically, I looked at the patents they were about to issue, and I said, if I were to get around these, what would I do? And then I filed continuation patents to cover that. We also have additional patents on the biology underlying the approach and the treatment of what are called bacterial biofilms. So actually, it's a platform technology that can handle other diseases in addition to acne, but acne is kind of our first bite at the apple.
Now, light therapy exists
yes.
for acne. So how is your light better?
We've done a couple of things. One, we picked the light to be at exactly the right wavelength to attack the acne that without causing the side effects it would have from, let's say, UV. The real kicker is the ultrasound. What the ultrasound is doing is activating the bacteria, is actually revving up its metabolism, and it's causing it to produce more of the photosensitive chemical internally, the photoporphyrin, that is light sensitive. So you've heard of photodynamic therapy. That's where they apply a chemical that makes the bacteria more light sensitive. We're using the ultrasound to do that, so it's a much more benevolent way to do it. And we found that it's very, very specific to the bacteria. It doesn't kill mammalian cells, but it will kill the bacteria. So it's really that extra juice you get from the ultrasound that makes the blue light work.
So is there any way to take this product direct to market without having to go through the FDA process, without having to have it prescription-based?
Yes and no. You have to go through the FDA. But this would be a Class 2 product. I've designed it so that the ultrasound is at levels that have already been approved and the light is at levels that have already been approved. And we have identified one predicate that allows us to do the 510K process. So we have to go through the FDA, but I don't see that as a big issue. The second question, why don't we go OTC? The issue there is we realize that if we were to go directly to OTC, that would be a big marketing cost. Forget the product development costs, you know, $5 million, whatever. Be $80 million to get the shelf space and to get the noise, to cut through the noise. We believe instead by doing is a segmented approach, establish the market through the dermatologist, get them on board with it, show that it's kind of clinically proven, and then once you've done that, then you can take it to the broader market saying, well, it's, you know, physician strength that you can now buy OTC. But we believe somebody else who already bought the shelf space, somebody like a Neutrogena, somebody like a L'Oreal that already has that space bought and paid for and now wants to put something else on the shelf, they'd be in a better position than we would be.
But look at the comparative sizes of those markets, though. Sorry.
I was about to say, I mean, there's corollaries out there. There's a company here in Philadelphia that has a no-no product for hair removal. So if you look at what they did, they went through FDA, but what they did is they go direct to the consumer. So they go through home shopping networks, they do direct response advertising, call centers, and just ship the product. They don't have a razor blade component to their model. It's primarily a device, but they kind of disintermediated the derms because the derms have big practices for hair removal as well. And so I'm with you. I think that there's, the unit economics on something like this, especially because you've got a great razor blade approach to it, could allow you to scale this a lot more rapidly than waiting on kind of B2B sales and kind of grow it one dermatologist at a time.
We don't disagree, but we also want to preserve our early investors, because if you're going to put in $100,000, but I know my next round is going to be $20, $30 million like a drug, that's just for the marketing. We think that would really squash things down. We think there's going to be an exit before we have to get there.
Here's your risk. Here's your risk. Your risk is you've got that big over-the-counter market there. You're futzing around with the dermatologists, who are not that easy to sell to as well, physicians in general. There's a consumable piece to that. I don't know how co-optable that consumable piece is in terms of someone else just, private labeling that piece and your physicians are buying that wherever they need. That I don't know, but while you're spending all that time trying to access that part of the market who's already selling a lot of different products to that category of patients, you've got this big OTC market that someone else could just come in and take over in this 2-year plus period that you're going through all these approvals and doing all of this.
Well, I have to go through the approvals no matter what.
You got to do that.
So that's a given. Again, the issue is that OTC market has a lot of noise in it. It's going to take a lot to cut through, and we believe the way to cut through that is to show that it really works. I mean, the no-no, great, but you have to look at, they've had their ups and downs, and everyone I know that's bought one, including my teenage daughter, said, it doesn't work. And she, it's tossed. I know some investors in the no-no, and they're not that happy. And it's going too quickly into a market like that, I think that's very risky. Your chances of creating are pretty quick.
That's an efficacy issue that you're talking about. That. Yeah. We're not talking about the same thing. If your product doesn't work either, they're going to toss it as well.
Absolutely.
So I think that's noise right now. I don't think that's
Talk to me about the cost of the device and the cost of the razor blade, the prescription.
The way we've modeled it out, it's also a volume issue. I mean, if I'm building it for the dermatologist, I have a certain rate, that's going to cost me about $200 a unit to build. When I get to OTC, I can drive that down to about $70 a unit. Now, some people have said, why don't you just give the unit away and work on the disposable? Disposables are going to be pennies, is what it's going to work. I don't want to go there. I'm just telling you the advice I've received.
All that disposable is contact gel, right? Is that what we're talking about here?
It's both the contact gel and a one-time use cover to keep it. And the things that they're sold together, so you can't separate them. Once you buy the cover, you get the gel with it. So that keeps people from using hair gel or whatever on it.
Look, I'm sold that there's a market here. This is a very unsatisfied market. It's cash pay, high unmet medical need. I'm a little worried about the FDA process. You're taking ultrasound, combining it with light, and have you had conversations with the FDA about because I'm an investor in a medical device company in Northern California, and years ago they had thought they had a straightforward path, and we're $13 million into it, and we still don't have FDA approval. We're going to get it, but you have 7.5 million as your invest. My concern is going to take me twice as much money to get us there.
That's a great point. We have not had any.
750K.
No, 7.5 million is
Million
second
is
phase.
for
the
second
next round
phase.
after this.
Yeah, we've got an incremental strategy on our 510K process. We're going to get the first 510K on a box that.
But have you talked to the FDA? That was my main question.
We have not yet talked to the FDA. We consulted several high-level, like NAMSA and some other groups that work very closely with the FDA. I'm actually an FDA advisor on ultrasound, so I know they actually have my equipment in the FDA ultrasound laboratory. I've sold it to them in my past lives. So I know all the people on the ultrasound side at the FDA. I'm a regulatory consultant for other companies like Siemens and Philips on medical ultrasound. So I have a pretty good feel for where this would be. Now, there's always a risk. You get a new reviewer who wants to make his name by shutting down everybody who comes through the door. There's always a risk. But we believe we have a very structured approach to it. The predicate device we're pointing to has an ultrasound unit and a light unit in the same handpiece. They don't run at the same time, though. Yeah. So the only thing we're saying is, well, we're going to have them run together. But you've already approved this other technology with the same characteristics. This is just the next step. That's also another reason why we're doing it prescription first, to give that level of control. And we're building in things like, in addition to the compliance, there's also a safety issue. We can make sure that it's only used so much a day. The FDA is always worried that if Johnny thinks 5 minutes is good, well, an hour must be better. The FDA gets squeamish at that. We can kind of program that out. So we've kind of got both sides figured out.
So what's your best case time frame towards the FDA? Best, average, worst case?
I expect to have our first 510K in about 7 months from right now. If I get that next round, that's going to start me on the process of building the preclinical prototypes that I will submit to the FDA. And again, on a 510K round. The nice thing about it is I can do that independently and get that out of the way well before I'm looking at my commercial launch. That's going to be on a pre-production product. And then I've got yet another year to, if I need more time, I have more time before I actually want to do the launch in 2018. So I'm going to start my 510K process before the end of the year.
So in the interest of time, what was your valuation at your last round?
$5 million. We did a convertible debt round with a $5 million cap on the convertible debt, a 25% discount.
And how did you come up with 500 for this round? I mean, this is.
Yeah, what's he
we use the term, it's either a bridge or a pier, and obviously you want it to be a bridge, but is 500 enough?
For what we plan on doing, again, our goal for this is to get the regulatory clearance and enough pilot data to convince the Series A investors that, yeah, you've reduced the regulatory risk and you've reduced the clinical risk. In other words, you know it works and you know you've got
So
a 510K.
it gets you how far?
What's that?
How far does it get you?
The $500,000, that gets us through that FDA process and gives us enough.
So you're saying a year?
Oh, it'll get us through the next year. That gives us the 510K plus enough runway to breathe while we're raising the Series A.
How dogmatic are you that you want to go to the dermatologist before you go to direct? Because I'm a big fan of this category. One, there's a real problem that you're trying to solve. Two is if you have the efficacy behind it, your users are going to love it. The third issue that I think I have, a bit of a problem with is I just think it's a slower rollout if you go through the derms than trying to go through home shopping and other visual mediums such as TV, because I think you have a great product to demonstrate efficacy through before and afters. And if you have those kind of unit economics, if you can bring this at scale down to $70 per device, Proactive's $1 billion business.
And $850 million, $200 million of that is marketing costs, and $5 million of that.
I get it. I mean, they sell almost
celebrities.
air. I
Yeah.
mean, their cost of goods are.
So are you in?
Really
So
tiny.
are you in?
I'm in. I have
So what do you say the terms?
I have a bit of an issue because I think that this is a kind of a binary outcome. You either have the efficacy and you get the FDA approval, or it's a.
Well, you don't need the efficacy for the FDA approval.
Right.
So
The
that's the
clinicals,
thing, that's still an
those
unanswered
run
question.
linked. That's
Yeah.
exactly
So
right.
guys,
Those are
Lions, Mark, I think, has done a very nice job presenting. He's made an ask. He's thrown a piece of raw meat here in the Lion's Den. What do you think?
I have a soft spot. I had a terrible case of acne growing up. I completely understand what it's all about, and I'm in for 50 at 5.
Okay.
I'm in for 100 contingent on my regulatory consultant
Fair enough.
verifying your regulatory path forward.
Absolutely.
I'm in for 50.
I got a 50. I got
50, 50, and 100. We got 200.
I'm in for 100.
300.
I lost track. Okay,
So we
that's
got 300 on the table. 304 lions so far.
And I'm in for 50.
350 in all 5 lions. Let's
Hey, can you go on the board? Hold on.
Well done.
Great job.
Hey, Mark, I got one request.
Yeah.
Michael goes on the board.
Yeah.
But you guys will work out the details.
Yeah, I support
Yeah.
that.
Observer
So,
Lucas, we're going to need more money to get to the 510K.
That's pretty impressive.
so can we get our Yorn slide up? So let's see what our audience thought of this. Obviously, the Lions loved it. And so did the audience. Look at that.
Everyone's had action.
Wow.
Wow.
Maybe,
I'm telling you. That's good.
maybe next year we'll just pass the hat and let's see what we can get. Now, before I bring up our last company to present this morning, or this afternoon, I should say, Purple Cloud Technologies, just a quick backdrop story. The entrepreneur here, Audria, just told us a little while ago after we had selected her to be the presenting entrepreneur that she, a few years ago, while a student at Drexel University, had been a volunteer to help us with the Impact Conference, which has now been going on for many years here in Philadelphia, and volunteered, worked here, was holding up the signs that said 10 minutes left, 5 minutes left in the back of the room. So she's had entrepreneurism in her blood for a long time, and here she is today, one of the 3 finalists selected. So give her a big round of applause.
Hello, everybody. I'm the last one. So my name's Audria Bogdanovichus. I'm the CEO and co-founder of Purple Cloud Technologies, and what we've built is a real-time task management and high-level data analysis platform for the hospitality industry. Just before I get into any bit of the business, we have a rock star advisory board, including the former CIO of Marriott International. He's been instrumental in making huge introductions for us. We've already been in contact with Marriott, IHG, Wyndham, and have been told that we are a no-brainer in the future of hospitality. And then Keith Coe helped us position with hotel management groups. So just a little background of what's happening in hotels right now is they are getting killed by TripAdvisor. Now Google Reviews is stepping into the field as well. And so you can see here, this is a fake traveler, Tom Nelson. However, this is actually TripAdvisor reviews of a real person. And you can see that down there, there's 97 reviews and 218 thumbs up helpful votes, meaning that this one person single-handedly influenced over $54,000 in nightly revenue. That's if those people were only staying one night. So if they were staying a week, that's hundreds of thousands of dollars off of one guy. And the thing is, 93% of global travelers are actually impacted by these bookings. So as you could see in the former slide that he was looking at his watch, right now there's tons of guest-facing applications. There's the Apple Watch, there's your mobile check-ins. However, with all this on-demand, I need my items right now, my question to you is, when guests have technology like this, why are hotels still be running like this? So 1980s DOS-based computer systems, including this hotel that we're in right now, are running clipboards, real-time, basically you have your radios and you're running around the hotel frantically. And I know, because I'm speaking from hotel experience for several years at the airport Marriott. So we're here to fix that. And what we've done is we've built Cielo, which is our flagship product, which is one platform for all of hotel operations. And what we do is we connect in real time directly to the property management system with a two-way integration, meaning that we pull the guest room and guest information and room data, and then we stream it directly to the staff in real time. So we have housekeepers, engineers, front desk managers, all separate modules, all in one program. Every single person has their own language. So you could write in any language, and everyone else will see in their preferred language. So for the first time ever, you actually have a very diverse staff talking with each other. And then what we do, and that's all mobile or on desktop, and then what we do is we take all the chatter, so as housekeepers are cleaning their rooms, they're reporting supplies that they're missing, we take millions of data points and analyze it for hotel ownership trend reports, so we can say, you're having a supply issue here, you're out of, you're having light bulb issues, replace that with this. We have significant cost savings. We've piloted at the Rittenhouse Hotel, who quickly became our first customer. What you can see here is that we have significant cost savings from just efficiency and productivity. That's about $77,000 on average per year per hotel. And then what was really interesting is after 7 months, we found 1.5 million data points at the Rittenhouse alone that led to 5 huge trends in this hotel to uncover another $60,000 in yearly cost savings. So basically, Hersha Hospitality, who owns this hotel, was thrilled by this and gave us 4 other hotels to work with right off the bat. So you can see here, there's Hersha Hospitality, our client, Stepstone starting in 2016, and in the past few weeks, we've been demoing back-to-back with hotel groups and have at least 3 hotel groups ready to sign with us. Our business model is $5 per room per month for Cielo Pro, and we're also launching a light version that's going to be less integrated and move a lot faster. So on average, we're getting about $26,000 in yearly revenue, and we're also launching trend reports later down the line. Our US market is obviously hotels. However, we have easy vertical markets to expand into, such as cruise lines, hospitals, casinos, luxury apartment buildings. So our US market is about $932 million in addressable revenue. You can see here our financial projections grow from about 10 hotels this year to about 1,300 hotels in 2019. So basically our main goals with that, our main goals with that are to work with third-party hotel groups, which have every brand under their umbrella. And as we're already talking to the huge corporate chains, they're very interested, we're creating kind of pseudo-pilots. So they're watching the results, and they're going to be ready to jump in. Since they have slower moving processes, we've already started that process with them. Oops, wrong button. Sorry about that. We have competitors, as everyone does. Our major one is called Hot Sauce. They were bought by Newmarket International in 2011, and they are an engineering platform that actually has housekeepers and other staff carry around laminated sheets of paper and dial codes into a telephone interface. So they are the big market leader. No Cross is similar in features to us. However, they're based in India, and we've heard a lot of hotels are dropping them because they don't have good customer support. Our potential exits are property management systems, guest-facing companies, and so on. We're raising $750,000, but we're asking $100,000 right now for 3% of our company. Thank you very much.
So just talk a little bit about the sales cycle involved. Sure. I mean, you say you've got 10 hotel chains in the pipeline. And
So basically what we found the sweet spot is to target hotel groups with about 130 hotels in them. So Hersha is one of those kinds of groups. We've been really lucky to have Carl Wilson as our advisor because he started to introduce us to other big companies. So basically we just target kind of someone within a financial role or an operational role, and then generally they'll do a pilot, but it's paid now. Before it wasn't paid. And then we'll start rolling out hotels after that.
So how long's the pilot, and then how long till they make a decision?
So the pilot is, with Rittenhouse, the pilot was 6 months. We have a hotel group that wants to do all 7 hotels at once. So it really is variable per hotel and their capital expenditure budgets because there is hardware involved.
Then talk about that. Talk about the expenditure that the hotel has to make for this, and also talk about how you came up with $5 per room per month.
So I'll start with the pricing first. So $5 per room per month was based off of the fact that we noticed we actually were given our competitors' pricing for the Rittenhouse Hotel.
You were given?
So we got a quote. We saw how much they were charging. We realized that we could be priced for a similar price because we heard that they were expensive. But we also realized that they had 15 users and we had unlimited users. So Rittenhouse has 65 users using our program daily, and they would only have 15. And when you saw that one slide about the analytics, that's where all that value was. So we knew that we could charge a similar price for the Pro model. I already forgot your first question, I'm sorry.
What's the outlay? Everyone normally does, don't worry. So what's the outlay in terms of what the hospital has to put out for its own technology piece of this?
Sure, so basically, it really depends on their capital expenditure budgets as well. So Hersha has been pretty good with their hardware devices. They just buy them upright. but we are talking to a hotel group in California right now. They want to do a leasing program with Apple. So it adds usually about $1.50 to $2 per room per month on top of that. And usually they can get that passed pretty well too.
First off, you're a very impressive and poised presenter, and
Thank you.
I want to congratulate you for getting customers so early in your life cycle. However, this is way out of my area of expertise, and I really can't add any value to your business, so I'm going to go out.
Okay, thank you.
Appreciate that. So,
John, you know, this is right up your alley.
I love
See,
it.
I mean,
No
you can't take the same out. You may have a different out, but you can't come up with the same one that Mike used.
So I'm going to put 50K at the terms you offer. I'm going to offer that. I love this. I love the platform play. My wheels are already spinning in terms of how do you integrate this in terms of the customer engagement and the reward points in the hotel systems, right? So you focused on the ops side of managing the business.
Right, exactly.
I like the strategy of going with groups like Hersha, the large hotel management companies. You know, obviously, I think you got to explore some revenue models where it's in their best interest to deploy these technologies, but the platform play is absolutely, you know, I love it.
Thank you. We just kind of going off of that, we just built an API to start integrating with guest-facing technologies. So there are hotel companies in New York. Alice App just raised a huge round. They're just kind of exploding right now. We are constantly talking to their CEO about, you know, integrating with their system so we can pull guest data directly into ours. For smaller groups, it's a very easy modal to pop up onto their website when they're logging into the internet. So we can just say, if you want something, we can feed that right into. So we're very active, and we're trying to make this, as you said, like a platform that can integrate many different technologies on here at once.
Yeah, there's many dizzying adjacencies you could get into, right? Because we're going into this whole sharing economy concept with things like Airbnb. And there's a service economy that enables the sharing economy, right? When we all start renting our homes and all this other stuff.
Right.
So, you know, I could see, I like focus for now, but I could see where this could go in a couple different directions.
So there's this workflow piece to this, but there's also an analytics piece to this. How have you packaged the analytics piece? Because it sounds like that is potentially a competitive advantage over what the paper competitors have provided. My concern, and I like the business, my concern is they're two very different businesses. Analytics and workflow management, how do you see that, and how do you intend to manage that as you grow?
So we find that to be the critical piece, and that a lot of other people are missing. So what we found is that, you know, you have your asset managers who really just care about the money, and then you have your operations team who really just care about the operations side of things. When you tie it together in one place, so we actually created a customer portal where they can log in, the asset managers can have a conversation with their general managers, and they can actually start getting their costs approved. So, you know, I really need new linens, for example. Here's why. You know, you can see here that my housekeepers are reporting 100 linens missing every single day, which is hitting my productivity, which is hitting our revenue, and all that kind of stuff. So if you don't tie them together, the value of the product drops significantly. So we find that by putting it together, it actually makes it much more valuable, and then the hotel group, and basically you have your asset managers and your operations people, the higher up people, all in one building. So they all know to look at this, and it really pushes this into more hotels. So we find that to be the sticky piece, basically.
Gotcha. How about switching costs? I mean, you talked about sticky there, but what does it really take just to switch out this technology for another?
So especially for integrated, it's very difficult. So Opera, which is owned by Oracle now, there's an interface cost, just like everything else. Expedia charges an interface cost, the key machines do. So there's huge costs to switch programs. However, the one group that we're talking to in California is planning to switch to ours from Hot Sauce. We also have another competitor that we're knocking out in Tennessee soon. So those people weren't integrated. So we are able to go in there, but they find that that real-time communication is key, and that's why, you know, they're really pushing for us.
So are you providing canned reports for the analytics at this point, or are you customizing what the customer's
A little bit of
asking
both.
for?
So we're going to be charging more for the custom ones, but we definitely have canned ones. So basically, you have, these are the messages, these are the inspection results, these are, you know, your most common items and everything like that. But we are looking to kind of partner with consultants because we want to offset that, because that's not scalable.
Can you just talk a little bit about your team and where you are, especially on the sales side?
Yeah, absolutely. So I'm one of the co-founders. I have the hospitality expertise. Kazistas Gaitis, as you can see on that slide, because I put it towards the end, is our CTO and co-founder. He's been coding over 20 years. He's worked for startups and J&J, and he's managed big teams of developers. So he programmed our whole entire platform. And then Edward Rabitz is our business development director, who's worked for IBM, and he also exited a digital marketing firm here. So we also have 9 part-time contractors, which are kind of a mix of co-ops and old co-ops that stayed on board and that are working for us as well.
Adria, I have to compliment you. You've done a lot with very little capital, and you should be applauded for that. But my question, the 2 advisors that you put their pictures up that have really a lot of strength in the hospitality space, have they been given equity just for their names, or have they written checks?
Yeah, so the one that hasn't written a check has no equity at all. He actually was just a Drexel professor, not the Marriott guy. He was a Drexel adjunct professor who just wanted to see me do well, so he was just willing to sit in on things and be an informal advisor. Carl has equity and he's an advisor. It was both. We had to have both.
Equity, but he wrote a check.
He did, yeah. Second meeting, $50,000 check.
Gotcha. So speaking of checks, we've got one offer. And while people are voting as to whether or not they would fund your company, I've been getting some comments, and it is an angel investor in the audience. He said, can angel investors in the audience participate in the round? No, but I'm sure Audrey would be happy to meet with you afterwards. So you've attracted some interest out there.
I've got one question that's really not that serious.
Sure.
You guys deal with mini bars? That's my favorite part of the hotel. I always look and see what's in there.
Now.
Yes or no?
We don't yet, but we do have some people who are using it for room service, so a little piece of the mini bar. But actually, most hotels are taking that out of their hotels now.
They are?
Sorry about that.
That's my favorite part.
Yep.
You want to talk just briefly about how you came up with your valuation?
Sure. So it's $3 million because of the fact that we took a look at all the comps, kind of New York, what are they selling, what are they valued at for basically early stage but have revenue, and we noticed they were about $4.5 million for enterprise software, mobile platforms. We noticed that Philadelphia, generally, you can't really raise money on that high of a valuation, to be honest with you.
Sounds like a challenge, guys. Sounds like a challenge.
So we know that, and then also, we also went a little bit lower just because of the fact that, we've been talking to people for a while now. We were learning things, and now we're at a point where we're really ready to raise. So $3 million was pretty much, we found it to be an incentive to invest in our company.
So this is the blue light special, but it won't last for long.
Exactly. Once Marriott signs, that's going away.
And when's that going to happen?
Soon, hopefully.
That's right. I'm in for 50.
Thank you.
Is there any reason why you're only asking for 100?
I watched Shark Tank, Scalli's in Bayada. They asked for $40,000, they got it, and then they met the President of the United States a couple weeks later. So, you ask low, and you get more later.
So you got the 100. Your ask has been fulfilled. Would you be willing to take more?
Yeah, I'll put 50 in. I think the valuation is fair. I think we're going to all have to write more checks, a lot more checks.
Awesome.
So it's a.
If Buck's in for 50, I'm guilted. I'm getting for 50.
200 grand.
Thank you very much.
Well, that's great. Congratulations. Well, guys, look, I said at the beginning of this, it was a bit of a risk. We didn't know whether or not they'd find anything they'd like, whether or not they would really make offers. And I want to first thank all of the Lions here, and I think they did a great job. So big round of applause for all of them as well. And with that, I'd like to turn it over to our other sponsor of this session, Bob Fesnak from RSM. Bob?
Thank you very much, Mark. First off, good afternoon, and I'm Bob Fesnak, partner at RSM. My role there is the management consulting leader in this region. But as some of you may have known, in the last couple weeks, McElladry rebranded itself RSM. So basically just combining one brand globally as opposed to two, which makes a heck of a lot of sense. Under either name, we are very proud to be a sponsor of the initial Lions Den here today. I thought the event was excellent. I don't know about you, but the presenters were all did a fabulous job, both with their business plan and also in their presentation, as the panel kind of mentioned. I think events like Impact. I think events like Impact are critical to the early stage ecosystem in this region. I mean, we all keep talking about helping early stage companies grow, help entrepreneurs to get seed money and move to the next level. And I think Impact, I think the panel with funding a couple companies goes a long way for that. So I applaud both PACT and I applaud the panel for their participation here today and putting this event together. So one other thing is that RSM will, in the beginning we agreed with Dean Miller that RSM would provide $2,500 of free partner time to any company that was funded today, and they can use it any way they want. So that's good. So finally, it's my pleasure to introduce Michael Heller and Ira Gubernick from Cozen O'Connor and Dean Miller from PAC. Thank you very much.
Michael, just before you started, we just wanted to point out on the last one, you can see the audience also strongly endorsed that. So pretty interesting that the two companies that got funded very much aligned to what you all think. So you should pat yourselves on the back. You could all be future Lions. Right. Thank you.
Mark, thank you. Real quick, just want to have it on record. We at Cozen will not be giving any free counsel to anybody.
About that.
First of all, we're so excited this went well. There was one risk and one risk only, and that was the Lions. We're still not sure whether we like them, but actually, no, they were terrific. So please, another round of applause for the Lions. This was really a phenomenal 2 days. We can't thank all of you enough for sponsoring, those of you who are the sponsors, for the participants, the presenting companies. Supporting the Impact Conference is really supporting the community at large here. So on behalf of my law firm, I want to thank all of you. This was really a terrific event, and now I hand it over to Dean.
I'm blown away, absolutely blown away at just what happened. And I want to thank you guys again, because you just made some dreams for a couple of entrepreneurs. This one's for David Freshman, by the way.
Yes.
He would love that thing. Hey, really quickly, just want to recognize a couple people. Jorn and Rick Rosansky for stepping in at the last minute to allow us to see what the audience was going to do instead of the Lions. Round of applause for Rick. Again, thank McCarter and English and RSM. I also want to recognize, you heard them giving free services. Evolve IP, who's in the house, Guy Fardone and his team, who are big sponsors of Impact, also are going to put up $10,000 in free connectivity services for the companies. So a big round of applause for Evolve IP. And then last but not least, again, a special thanks to Ira and to Michael for their leadership. We have raised the bar in this conference, and I feel bad, as I said to Michael, for Emmanuel John, next year's chairman. Emmanuel, if you're out in the audience, I hope you're thinking of how we're going to do it. We've got one final event left, and to get there, you got to go across the street. So hustle there, because in 3 minutes, the cocktails are starting to be served at the gala at the Crystal Tea Room. Thank you again, everyone. Thank you to our moderator as well, Mark Letterman.